Medicare Babe Series 2. Medicare coverage and costs depends on your coverage option. In this video we go over cost of original Medicare and the cost of other Medicare options. Medicare Part A covers hospital stays and most of the inpatient services. Medicare covered inpatient hospital services include semi-private rooms, meals, general nursing, drugs, including methadone to treat an opioid use disorder, other hospital services and supplies as part of your inpatient treatment. Part A costs. Premium $0 per month. If you or your spouse made payroll contributions to Social Security for at least 10 years, 40 quarters. Otherwise, your premium could be up to $505 per month. Your premium may be higher if you do not sign up for Medicare when you are first eligible. A Part A deductible $1,676 per benefit period. A benefit period begins the day you are admitted to the hospital and ends when you have been out of the hospital 60 days in a row. Your cost for a hospital stay after the deductible has been met will be $0 for days 0 through 60, plus copays of $419 per day for days 61 through 90 and $838 per days 91 plus. You have 60 lifetime reserve days of coverage you can use if you're the hospital longer than 90 days. Each lifetime reserve day may be used only once, but you may apply the days to different benefits periods. Lifetime reserve days may not be used to extend coverage in a skilled nursing facility. Once you have used all of your 60 reserve days, you will pay all the cost. Also, if you out of hospital for greater than 60 days, you have to meet the Part A deductible again. Since Part A deductible is not an annual deductible, you can have to meet it several times in a year. Original Medicare does not have an out-of-pocket limit. For hospice care, you pay a copayment of up to $5 for each prescription for outpatient drugs for pain and symptom management. And Part A coinsurance. You may pay 5% of the Medicare approved amount for inpatient respite care or durable medical equipment used at home. Medicare Part B covers care at a clinic or at a hospital as an outpatient. Coverage includes doctor visits, including in the hospital, annual wellness visit, ambulatory surgery center services, ambulance and emergency room services, skilled nursing services, preventive services, like flu shots or mammograms, clinical laboratory services, like blood and urine tests, X-rays, MRIs, CT scans, EKGs and some other diagnostic tests. Some health programs, like smoking cessation, obesity counseling and cardiac rehab. Physical therapy, occupational therapy and speech-language pathology services. Diabetes screenings, diabetes education and certain diabetes supplies. Mental health care. Durable medical equipment for use at home, like wheelchairs and walkers. Medicare Part B costs will include: the standard monthly Part B premium will be $185 in 2025, an increase of $10.30 from $174.70 in 2024. However, some Medicare beneficiaries may pay less than this amount because, by law, Part B premiums for current enrollees cannot increase by more than the amount of the cost of living adjustment for Social Security, Railroad Retirement Tier 1, benefits. The monthly Part B premium that includes an income-related adjustment for 2025 will range from $259 to $628.90, depending on the extent to which an individual beneficiary's modified adjusted gross income exceeds $106,000, or $212,000 for a married couple. The highest rate applies to beneficiaries whose incomes exceed $500,000, or $750,000 for a married couple. In 2025, the Part B annual deductible will be $257. Once the Part B deductible is met, you are responsible for 20% of all Part B covered services except preventive services. You will pay the standard amount if enroll in Part B for the first time in 2025. Don't get Social Security benefits. Are directly billed for your Part B premiums. Have Medicare and Medicaid pays your premiums. Medicare approved amount. The amount Medicare decides providers should be paid for covered services. Doctors and other providers may accept assignment and take Medicare approved amount as payment in full, even if it's less than what they usually charge. Doctors who do not accept assignment may charge more than the Medicare approved amount and bill you for the difference. The additional amount they may bill, called excess charge, is based on Medicare reduces the Medicare approved amount by 5%. Medicare pays 80% and you pay 20% of the reduced amount. The doctor may then charge you an additional amount, up to 15% of the reduced Medicare approved amount. Enroll in Original Medicare, Parts A and B, on time to avoid late enrollment penalties. Part A late enrollment penalty 10% of the premium. If you must pay a Part A premium and enroll late, you could pay a penalty. The late enrollment penalty is 10% of the premium. You pay the penalty in addition to your premium for twice the number of years you delay enrollment. Part B late enrollment penalty 10% of the premium. The Part B penalty is 10% of the monthly premium amount for each full 12-month period enrollment is delayed. You pay the penalty in addition to your premium for as long as you have Part B. Original Medicare, Parts A and B, doesn't cover everything, like these benefits. Like most care, outside of U.S., personal expenses while hospitalized, such as a TV or phone. Custodial care, long-term care, days spent in a psychiatric hospital beyond certain set limits. Hospital days beyond set limits. Also, eye exams, eyeglasses or contact lenses. Hearing exams or hearing aids. Dental exams or cleanings, x-rays or routine dental care. Most prescription drugs. Wellness benefits such as gym memberships. Medicare Advantage, Part C, plans combine Part A and B benefits. Medicare Advantage plans are offered by private insurance companies approved by Medicare. In addition to Part A and Part B benefits, many plans offer Part D prescription drug coverage, hearing exams or hearing aids, dental exams, cleanings, x-rays or routine dental care, eye exams, eyeglasses or contact lenses, wellness benefits such as gym memberships. Benefits vary by plan and could include other extra benefits such as transportation to medical appointments and virtual visits. Medicare Advantage plan costs vary by plan provider. Medicare Advantage plans are often premium-free. You will continue to pay your Part B premium directly to Medicare, and your Part A premium too, if you have one. Some plans may change premiums, deductibles, copays or coinsurance. Plan premiums can change each year. Copays amount may vary based on the covered item or service. Deductibles may be applied to drug benefits and not medical benefits. When a plan covers both, coinsurance may apply for some services. Where you get care can affect your costs. Many Medicare Advantage plans are coordinated care plans and contract with network of doctors and hospitals. Some plans may require you to choose your primary care provider from their network, and each plan creates its own network. Certain types of plans may allow for more freedom to choosing providers, but cost could vary based on selected provider. Cost for providers and service can vary if they are considered in-network versus out-of-network. In most cases, you pay less for care received from in-network providers than for providers outside the network. All plans are required to offer nationwide coverage for emergency care, urgent care, and renal dialysis. Understanding the out-of-pocket maximum. Medicare Advantage plans are required to set an out-of-pocket maximum, which is the amount you may pay for cover service during the plan period, usually a calendar year. The goal of the out-of-pocket maximum is to help provide some financial protection for out-of-pocket costs. Original Medicare doesn't offer out-of-pocket maximum. Plans can have different out-of-pocket maximums so long as the amount doesn't exceed the year's out-of-pocket maximum limit that is set by Medicare. This limit can change each year. If you reach the out-of-pocket maximum, your plan will then pay for all your covered costs for the remainder of the plan period. It is important to understand the following costs do not count towards the out-of-pocket maximum: the premium payment, drug cost, the cost of extra health service a plan may offer such as vision or dental. Look into the future with us. Discover our strategic vision in the Medicare Babe series roadmap that guides your learning towards understanding Medicare. In this video, the third of 5-part series, we've covered the original Medicare Part A and B cost, late enrollment penalties, and the Part C, Medicare Advantage, option and cost. We revealed the most critical insight to empower you to make informed decisions about your healthcare. Remember, knowing your options can make all the difference in getting the healthcare you need. If you have questions about Medicare or any other healthcare topic, please comment below. And don't forget to check out our other videos in this Medicare Babe series on Medicare. Don't forget to watch the previous videos in our Medicare series. For more information, visit our website, www.camaraderiehealthagency.com.